before 8:30 at night.
A new class of treatment for type 2 diabetes is set to become cheaper when it's listed on the Pharmaceutical Benefits Scheme next month.
Diabetes Australia has welcomed the development, which enables the chronic disease to be managed through the kidneys, independent of insulin.
48-year-old Michael Moore found out he had type 2 diabetes 15 years ago. For the past few years, he's been managing the disease through diet and exercise, along with medication.
I have noticed my diabetes levels have dropped, and since starting the new medication it's continued to go down, and my weight is dropping down along with everything else.
For the past month, he's been trialling SGLT2 inhibitors, which manage the disease through the kidneys rather than the pancreas or liver. Endocrinologist Associate Professor Roger Chen says it's a whole new perspective on dealing with diabetes.
It reduces the kidney's capacity to reabsorb glucose or sugar, so you actually excrete or get rid of more glucose from your body.
There may be side effects. Dr. Chen says there may be an increased risk of urine infections and thrush. And it's too early to say whether it could decrease the risk of stroke, although controlling blood sugar levels and blood pressure is known to reduce that likelihood. At the moment, the treatment costs $90 a month. Once listed on the Pharmaceutical Benefits Scheme, it could cost as little as $6.
Diabetes Australia says 1.5 million Australians have diabetes, 85% of those with type 2. It welcomes the addition of affordable treatments to fight the growing epidemic.
Professor Greg Johnson says the new class of inhibitors may be used alongside other tablets or insulin.
Many people need multiple treatments. They get put on one drug and that may work for a time, but then it unfortunately doesn't work so well. At the moment, they've not been associated with weight gain. That's often a problem with other diabetes treatments. And they're also not associated with low blood glucose levels.
Professor Johnson says long-term monitoring is needed to ensure the treatment's ongoing safety. Cassandra Hill, World News Australia.